So, welcome to the RMD Podcast and channel with me, your host, Dr. Debra Durst. So, I am a traditionally trained physician that now practices regenerative medicine, and I am here with my co-host.
Hey guys, Farideh Golumbiaski. I'm a board certified family nurse practitioner and I work alongside Dr. Durst at Revitalize MD.
So, what we get to do is, optimize people in all kinds of very comprehensive ways, right? So, we get
with
to
all kinds of
address,
fun treatments.
yes, fun treatments that you may not, it's science-based, but non-traditional, comprehensive, maybe not meds, maybe not surgery, but even today we're going to talk about vitamin D and healing. And so again, it's vitamin D, and we don't hear that much about it, and we all need it. Yes. So vitamin D, it's so important for both bone, and everyone thinks of bone, but also just muscle. So muscle health and bone. So bone and muscle strengthening. Mm-hmm. But again, this is a vitamin that is so easy to measure, so easy to optimize,
so easy to screen for.
And to supplement and optimize, and such benefits. So what is vitamin D? What are the levels that are optimal, and how do you take it, and do you need it? Can you just get it in food? And what do we do in practice? So basically, vitamin D is a fat-soluble vitamin, so it is stored in the body versus a lot of the water-soluble vitamins. And
so that means it can become toxic in high levels.
Correct.
But those are very high levels and usually not something that we worry about, but that's why you have to screen for it.
Correct, and that's why you'll hear a lot more about vitamin D, because it is a fat-soluble vitamin. Most of them are water-soluble. You're going to urinate out most of them unless you take them in super high doses, but this one is actually stored in the body. But what's the other myth is that people think, I'm out in the sun, it's summer, I don't need it.
Yeah.
And
not true.
Not true. So unfortunately, you almost need to be naked, full body, peak sun for hours.
Yeah, 90% exposed for at least an hour or two.
Yes. And so if you're doing that, great. More
But
power
even some
to
of
you.
us that do that still do not convert well.
Yes. So the skin does not convert that vitamin. So like basically you have, the precursor in the skin, you're going to get conversion in the skin to 25 vitamin D, and then that goes and is stored in the liver until needed, and then activated in the kidneys to an active form of 125 vitamin D3. And so basically what you're talking about is there's obviously a way to convert in the skin. We don't convert very well, and there's lots of processes in the body, but this is not just a vitamin, it's a prohormone. So it actually goes into the nucleus of a cell and has transcriptional activity in about 300 processes,
which makes it very special.
It makes it very special. So again, hormones, and this is a prohormone, can have effects on the body and functions in the body, and it has
a hormone that's listed as a vitamin.
I know,
so everyone has access.
Yes, yeah, and just think about it. And we don't even talk about it. Maybe that's why everyone's scared of it, because we hear all the time that, again, you're on too much. The primary doctors will tell them they're on too much. The family members, everybody is overly concerned, but we follow levels closely, and we will optimize to optimal levels. So let's talk about what those are. Again, active in 300 processes in the body, levels deficient,
less than 25?
Less than 20.
I think it's actually less than 30.
Yeah, well, actually,
lab,
insufficient. Right? Yeah, so insufficient is like 21 to 30. So like 30. If you're less than 20, you're, again, deficient, not just insufficient. But the Institute of Medicine, your level is 20. They're good with that. Endocrine Society,
that's crazy.
30. And so, but 50 to 80% of the population is actually low. I would almost venture to say that almost every patient not on a supplement when they come to us is low in vitamin D. So if they have a decent level, which is above 30, that they're on something, even if they're above 30 most of the time.
And this is a supplement that you're having to supplement, right? Unless you're drinking whole milk. There is not a lot of sources to get a good amount of vitamin D other than from the sun. or whole milk.
Yeah, no, so and you can do different fishes and, there's some ways to get it, but no one takes in enough in a nutrient form. So you really do have to supplement. And not a lot of food is fortified with vitamin D versus other
And
countries.
honestly, if you're eating fortified foods, they're foods we don't want you eating anyway.
Yes, correct. And so there's lots of issues. So the bottom line, but it's easy to actually supplement with. And so,
And it's readily available.
yeah, and we actually can even do it in the shot form, and we'll talk about that. So there's some studies. We'll always dive into some of the studies and then a more practical aspect of whatever topic it is we're talking about. A meta-analysis in 2015 that basically looked at a lot of studies of vitamin D and surgical recovery. So this was like the first of its type to look for studies related to surgical recovery. They found 31 of 90 of those that met the inclusion, and greater than 16,000 patients, adult and pediatric, any surgery and any design for review. And basically they found that there are some, bad outcomes, or, again, it's not a cause effect, but there's some bad outcomes that at least the patients had low vitamin Ds. So they did have a low vitamin D. They didn't have, optimal outcomes. But the 2 times of measurement were 12 hours before, 12 hours after. But really the time at surgery mattered. So what your vitamin D level is at the time of surgery is huge. And so, but if you think
For
about,
lots of reasons, for healing, for musculoskeletal, but really for bone health.
yes, and there's so many benefits of it. There
And
is
vitamin
mood.
D is necessary
Yeah.
to get calcium into the body.
Yeah. So again, vitamin D, calcium influx from, you have to absorb, but you also are fluxing it from the bone. And there's about 300 other processes.
Yeah.
And so sometimes even weight loss and weight maintenance and mood, but again, immune function is huge. And so when we're talking about surgery outcomes and recoveries, immunity is huge. And with COVID, they did studies and no one that was in the ICU had a level greater than 30. So I would argue that that level of 30 is not an adequate level at all. And so 26 out of the 31 had some, or bad outcome, or negative, not optimal outcome, and a low vitamin D. But those outcomes were varied. So it could be infection at the site, just post-operative, but it also depended on surgery. So if they had a kidney transplant, you could have rejection, graft failure, even some cancers that were increased. Yeah. With low vitamin D.
Fourfold increase.
Yeah. So
That's a big jump.
And it wasn't necessarily saying that the low vitamin D caused that, but there was a low vitamin D present.
They're just saying it was present in all these instances where there was failure.
Yes, and there
or
was
negative outcomes.
A lot of varied outcomes, and so we will put a link to that study for you to look at. But again, suboptimal outcomes: surgical site infection, hospital-acquired infections, cancers, but also cardiovascular risk, stroke. And just prolonged hospital stay, ICU admission. And again, in COVID, ICU study that showed, again, no one in the ICU with a level greater than 30. And that would have been a very easy thing across the board on every news outlet, or maybe in the ticker at the bottom of the screen. The death ticker could have had right above it.
Take your vitamin D.
Optimize your vitamin D. Yeah, we could have had that right above, that very odd death ticker that we had going on that went away suddenly. But anyhow, so the most important level, again, at the time of surgery, and it's important for all the things we mentioned.
Yeah,
but
and they were looking at 2 weeks prior to surgery. So if you have a surgery coming up, you've got time to get that vitamin D level up, having your vitamin D tested prior for better all bone health and hopefully even more successful surgery potentially.
So we do peptides, which is a progressive area of medicine. So we do have orthopedics that we work with here, and we will use some peptides in prep for surgery, in the pre-operative, perioperative, post-operative. But again, we will look at vitamin D levels, and if something needs to be elevated and more quickly, there is a shot form. And so that brings me to the point where it's so easy to measure. It's not expensive.
It's a blood test.
Optimize it. And even if somebody couldn't take an oral or PO, they could do a shot in these patients to get their levels up.
And
so,
injections can be 50,000, 100,000 IUs. You can have pretty high doses as an injectable form that are safe.
Yes. And it is readily available. It's not one of those injectables that is like something you can talk about in academics but never get, because we do vitamin D injections in the office and have since the very beginning because of the importance of it. So the optimal level, 75 to 100 is optimal level. It's very easy to measure. It's low cost to measure. It's low cost to actually optimize, and significant decrease in morbidity and mortality. And again, almost across the board in the studies, it'll say, more studies needed, And there's always
this is
more
a pet
studies.
peeve for a lot of non-traditional, right? Things that are really we all should be treating and doing.
Yeah. I mean, more studies needed. Does it really cause it? Is there long term? I mean, I think, again, it comes down to, is there safety? Is there ease? Is there...
what are the benefits? What are the side effects? What is ease of, access to patients?
Yeah.
And then implementing it.
To me.
Right? So every single patient we see that walks in our door that does labs with us gets a vitamin D level.
So
as a screen, no matter what.
No matter what. And we do follow it because we will optimize and keep them optimal. So I would say easily measurable. So add it on. Optimal, 75 to 100. If they're not there, then and they need to be there, shot, load, as you would anything else, and then oral supplementation after. And why? Because it is needed in 300 functions in the body. Immune function is one of them.
Energy.
If you're hospitalized, you clearly need immunity because of exposure, let alone whatever procedure you're hospitalized for.
So bone health, musculoskeletal health, energy, what else do we... Immunity.
Sanity, my sanity.
Your
How about
sanity.
that? Yeah. Just optimize it for my sanity. So I think it's very simple to me.
Leave a comment. Let Dr. Durst know you're taking your vitamin D, please.
Yes.
She needs all the sanity.
So I do. This is true. So I think the key is, let us know if you're on vitamin D. Let us know if your doctor has talked to you about vitamin D. Have you ever gotten a shot of vitamin D? Have they talked to you about it in the hospital? Because I did ER for greater than a couple decades, and we screened people for influenza vaccines. We screened people for depression, suicidal thoughts. Like we're talking about, they came in with a sore throat in the ER and we're screening them. Like the screening was extensive. And so are we screening for vitamin D? Has somebody recently been hospitalized in the ICU? Because there's also another study that we'll review that just was related to ICU admissions and low vitamin Ds. That was more specific with this optimal level. So anyhow, we would love to hear your comments. Yeah. Keep me sane for sure. So definitely make sure your doctor checks your vitamin D and keeps you optimal so you're nice and healthy. And let us know if there's anything else you want to hear about. Do you have anything else to say that
I was just going to say,
Just
if you're having surgery, even for healing, I mean, all the things. Vitamin D really is for all the things. 300 pathways.
Yeah, no. It's very important. Air travel, you should have immunity. So if you're flying, definitely want immunity before that so you don't get infection. So anyhow, let us know your comments, thoughts, and let us know if you want to hear anything else, because we are willing to deep dive into anything wellness or sexual wellness or really anything of importance to you.